Have you felt like your ADHD symptoms have gotten worse in your late 30s and early 40s? You're not alone. Welcome back to Mayhem and Grace. I'm Dr. Jessica McCarthy, and today we're talking all things ADHD and perimenopause. So let's get into it. You're having children, maybe done having children, getting into the rhythm with career, life at home, and then all of a sudden, seemingly overnight, it's like your body and brain got hit by a freight train. We're talking brain fog, we're talking memory issues, we're talking fatigue, we're talking mood swings, we're talking difficulties with sleep, we're talking hot flashes. But what ends up happening? You go talk to your OBGYN, and this is my experience, they're like, oh, you're fine, you're nowhere near perimenopause, you can still have babies. And that is true, you actually still can get pregnant during perimenopause, so this is not the time to pull the goalkeeper. But the reality of it is that you're not imagining it. The brain fog is thick, simple tasks now seem impossible, and sleep just seems to be a thing of the past. One of the great things is that research is starting over the last decade or so to pay attention to some of these fluctuations that happen during perimenopause. So let's get into some of that research and what you can do. First, let's actually understand what perimenopause is. Perimenopause is the period of time that is a transition period between a woman's reproductive years and menopause, when the baby making machine is fully shut down and closed and your menstrual cycles cease. Again, you still can get pregnant during this time, but one of the reasons why it's also so chaotic, those same hormones that are responsible for your period, for maintaining pregnancies, are kind of on the roller coaster ride that seems to never end. What we know also about these hormone fluctuations is that they can substantially fluctuate within a 24 to 48 hour period, which is one of the reasons why if a woman were to speak to her OBGYN and say, hey, I want to have my hormones tested, they're gonna say, don't bother, because the majority of the blood work tests that are available through your doctor, they are looking at a point in time. So you can have your estrogen, progesterone, testosterone tested, and it's going to be a fixed point that doesn't really tell you much, especially in this stage of perimenopause, where you would need to do multiple testing time points over a 24 to 48 hour period and look at other chemicals within the body, such as cortisol, also testing for thyroid issues to see, is this actually perimenopause or is this another medical condition that's happening? So while research is starting to pay attention to these issues that women are having as they are entering perimenopause, there's still a lot that we don't know. But the good news, or not so good news, depending on how you look at it, is that we are starting to understand a little bit more about how women with ADHD or with undiagnosed ADHD are experiencing perimenopause and what we in either mental health or in the medical field can do to help. So before going forward, we need to understand that perimenopause is characterized by these symptoms that actually can mimic ADHD. We're talking about the cognitive changes, difficulties with attention, difficulties with memory, difficulties with executive function. So task management, time management, organizing. No, it's a hot mess. And it's kind of where I'm at this morning myself, as I'm also thinking, like, I didn't even take my ADHD meds, so I feel like I'm like out there in left field. But just because you are experiencing those symptoms as a function of perimenopause, it does not mean you have ADHD, okay? What's important to understand about ADHD is that it is a neurodevelopmental difference or condition, meaning that it's something that has been present since childhood. Now, whether or not it was diagnosed is a different story. And why is that? There's a difference between men and women, boys and girls, with regards to how ADHD typically presents, especially in those childhood years. Boys tend to get diagnosed when they're younger because they tend to present with a more hyperactive presentation. So fidgeting, moving around the classroom, and guess what happens? It's a problem for classroom management and it's a problem for teachers, which is why it gets flagged. Whereas girls tend to have more of an inattentive presentation, and as a result, girls tend to get diagnosed until a little later, or they don't get diagnosed at all. Why? Because society kind of gives them the message of, you need to figure it out, it's fine, you're making too big of a deal out of this, it's not a problem. And guess what? That same rhetoric is continued through your 20s, through your 30s, and your 40s when you hit perimenopause. But the story changes a little bit. I've heard things clinically in office where it's like, oh, I'm just not interested in sex anymore. This is my fault. I've gained weight. This is my fault. I'm not happy in my career. I'm not happy with this. This is all me, 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 me. And the reality of it is that women are just tired. Women without ADHD are tired, and women with ADHD are especially tired because women with ADHD have been masking and pretending and putting all of this effort into presenting themselves to society, in work, in family functions, even with friends, as, hey, I've got it together, right? But it's a tremendous amount of energy that women are putting out, women with ADHD are putting out just to barely tread water. So then when you throw the hormone fluctuations of perimenopause into the mix, functioning becomes nearly impossible at times. But for women who don't have ADHD, even if they have these similar struggles during perimenopause, they weren't present during childhood, adolescent, and during the earlier adult years. They didn't have problems, for the most part, with managing time, managing tasks, paying attention, getting work done. There might have been fluctuations because a rough night of sleep can impact attention, but it wasn't this chronic, ongoing, pervasive, ever-present difficulty with attention, memory, concentration, executive function, just even trying to manage a space and keep that organized. My locker was always a mess in elementary school, my cubby in elementary school, middle school, high school, there was crap all over it. I would have periods of fixation, like, oh, I'm gonna get it fixed, it's gonna be clean, it's gonna be great. Same thing for me with using a planner. I figured it out because I was more or less told that I had to, and there weren't resources or supports in place because we didn't talk about ADHD in that way. And I made it through, but I struggled. And now that I'm getting closer to perimenopause and probably knocking on the door of it, if I'm being honest, I feel like I've gone from okay, I've got this, to what the fuck is going on? Now, I also got divorced almost 5 years ago now. So between that, COVID, my children growing up, I dismissed a lot of what was going on as adjustment to life post-divorce, managing growing a business, managing the needs of my children, until I got to the point where I was like, this isn't getting any better. It's actually getting worse. What am I doing wrong? I'm the problem. But wait a second. I'm also waking up in the middle of the night drenched in sweat. That's not normal. Unfortunately, I also need to mention that women with ADHD tend to experience perimenopausal symptoms up to 10 years before non-ADHD women. They also tend to experience them at a greater level of severity. So let's get into this. A study in 2025 came out noting that women with ADHD tend to experience earlier and more severe symptoms of perimenopause relative to their non-ADHD counterparts. So women with ADHD tend to experience the more severe symptoms by their late 30s, whereas women without ADHD tend to see their symptoms related to perimenopause peak more in their mid-40s. And unfortunately, this is the case across a number of symptom categories. Psychological, somatic, which means kind of the physical or bodily sensations, and urogenital, which is the intersection of a woman's genital and urinary systems. And there are a number of hormones that are responsible for these changes, not just during perimenopause, but during the menstrual cycle as well during a woman's reproductive years. The number one hormone implicated in this is estrogen. If you've been paying attention to social media, you've heard a lot about estrogen being one of the main culprits that we see fluctuating in perimenopause, and that's responsible for a lot of symptoms. And if you look at the breakdown even further with regards to those symptoms, almost 60% of women with ADHD reported severe psychological symptoms such as depression, anxiety, anger, and substantial mood fluctuations. When we're looking at somatic symptoms, almost 30% of ADHD women reported experiencing those symptoms in severe ranges. With regards to those bodily or those somatic symptoms, over 30% of women with ADHD reported experiencing severe somatic symptoms. So this, yep, you guessed it, hot flashes, insomnia, and aches and pains. And over 40% of women with ADHD experienced severe urogenital problems. So this is difficulty with bladder function and sexual dysfunction, specifically with regards to pain during intercourse. So across the board, women, especially women with ADHD, are just not feeling right. And it's also important to note that women without ADHD are also experiencing these symptoms and experiencing them at severe levels. It's just that women with ADHD are having higher frequencies of these severe symptoms and they're experiencing them earlier in life. Now, let's talk about hormones. But before we talk about hormones, it's also important to note that some of the symptoms that we're talking about here, brain fog, low energy, heavy periods, may or may not be related to perimenopause. So one of the things that I do as a psychologist when I work with women who are reporting some of these symptoms and either they're new onset or they've gotten worse as a function of kind of being in this sweet spot related to age, I tell everyone to go get a physical. Some women are great at getting physicals, some are not because they're too busy taking care of everyone else. But it's important to understand that certain deficiencies in vitamins, in iron levels, can also be contributing to some of these symptoms. So before we go assuming that we're in perimenopause or we need hormone replacement therapy, it is essential to get blood work done related to your entire body system so we know what is going on and how certain organ systems are working, such as your thyroid, how your blood work is looking, how your body is processing certain vitamins, because there's other things that we might be able to do instead of or in supplement to hormone replacement to help you feel and function a little bit better. So let's talk about hormones. One of the hormones that's most frequently discussed with regards to perimenopause is estrogen. Estrogen is important for a number of reasons. We think about it in the context of menstruation, of pregnancy. We also think about it as one of the hormones that helps to kickstart dopamine, which is one of the main neurotransmitters that's implicated in ADHD. Dopamine is often thought of as a reward transmitter. People think about that in the context of, ooh, my dopamine is going to spike after I completed a task, but actually it's a little bit different. Dopamine is actually a pursuit neurotransmitter, meaning that dopamine levels start to increase when you are in pursuit of something, which is why sometimes people can report, like when you're finally getting going on a task, it's like, oh, my brain finally feels like it's coming around. For people without ADHD, dopamine kicks in right away. So when you start a task, you get going. For people without the ADHD, the dopamine is just not firing the way that it needs to. When you throw fluctuating estrogen into the mix, so if the estrogen is not kicking the way it needs to help activate dopamine, you're going to see a greater pronunciation of the perimenopausal symptoms in women with ADHD. And this is why ADHD medication is important, whether or not you are in perimenopause or not, because the ADHD medications target dopamine. It gives people with ADHD that kind of little get-going boost to help dial in and focus and to be able to do the tasks that their non-ADHD counterparts are able to do pretty easily. So, what's the big takeaway? Estrogen is a critical part of the perimenopause picture. For women without ADHD, they're going to experience some of the same symptoms that women with ADHD are going to have as a function of this decrease in estrogen that impacts how dopamine, which again is that pursuit neurotransmitter, works. However, for women with ADHD, we're already functioning with the strike against us because our dopamine systems do not work as well as those women without ADHD. So when you throw the declining estrogen, which we so very much need, we're going to have a more severe symptom presentation and it's going to last longer. Progesterone and testosterone, two other hormones, are also implicated here, but the research is less clear with regards to these two hormones. Some of the research talks about the role of testosterone, and we think that should play a stronger role in ADHD because boys have higher levels of testosterone and boys tend to get diagnosed earlier. However, that research is inconclusive. But what we seem to be starting to come to a consensus on is that it's a delicate dance between all three hormones. As estrogen drops and as progesterone and testosterone increase, that's when we tend to see just an absolute chaotic mess when it comes to these symptoms of perimenopause. And again, for women with ADHD, they are going to be substantially worse: the physical, the cognitive, and the urogenital. And specifically with regards to the cognitive symptoms that we talk about in ADHD, again, it's brain fog, but we also start to see a little bit more impulsivity. And it's also important to note that that delicate dance tends to impact women who have more of the hyperactive or more impulsive presentation than not. But again, research is still emerging in this area. We need to be doing more of it so we can really understand how to best treat women. But when women do talk with their providers about hormone replacement therapy, estrogen is one of the topics that is most frequently discussed, and oftentimes women are prescribed what's called an estradiol patch. Estradiol is one of the types of estrogen hormones. It's a patch that's worn, it's changed every few days, and that can tend to help women because, again, we know a lot more about estrogen than not. However, there are other doctors that are doing other types of hormone replacement therapies, including with testosterone. There is not a one-size-fits-all approach here. It would be great, right? Wouldn't it be great if we could treat some of these symptoms the same way we do as a strep throat? Oh, you have strep, take one of the penicillins, you're good to go. It's not a one-size-fits-all. And it's also worth mentioning that none of these HRTs, these hormone replacement therapies, are covered by insurance. And the irony of it is that if a male was experiencing low testosterone, guess what? Insurance covers that if they wanted to get hormone replacement therapy. So not only are we kind of at a lack of understanding, a full understanding about the role of ADHD and perimenopause, whether or not you even have ADHD, because it's just not that strong of an area of focus relative to other areas or relative to conditions that impact both men and women. There's also a disparity with regards to access to care and treatment. So what can be done to help? The good news is that if you do have ADHD, your prescriber, and hopefully if they are well versed in this research, which unfortunately not every prescriber is, when you are either in perimenopause or even if you are still of menstruating age and we see these estrogen levels dip at different points of your cycle, your prescriber can actually increase the amount of ADHD medication you're taking to kind of counteract for those estrogen dips. But again, before doing this, your prescriber, and I've had women do this in my practice too, will ask you to track your cycle to see if it's regular and to get an understanding not just of the regularity of your period, but also the symptoms that are presenting at different points in the cycle so we can have a better idea of when to actually tweak those medications. It's also important to note that some of the hormone replacement therapies that work during perimenopause don't work during menopause. So again, this is a constant, not one size fits all for women or for station in life as far as how we are using hormones and other medications to adjust for the symptoms that are occurring during both perimenopause and the menopausal periods. Now, let's not jump down my throat here, I'm only the messenger. But what I'm about to say is going to get a lot of eye rolls from people because one of the things that is most beneficial with helping women with ADHD or without ADHD during perimenopause is lifestyle choices. Well, being mindful of your sleep hygiene, so trying to go to bed and wake up at the same time every day, provided you're even getting sleep. Exercise with a special emphasis on strength training. And if you've been following my Instagram or new to this channel, you know I absolutely love strength training. It has been life-changing for me, and there is so much science pointing to not just exercise in general for women, but strength training, especially for women that are approaching or in perimenopause and beyond. Leaning on community supports, friends, family, other women who are in this with you, as well as seeking out mental health care during this time. These are all critical tools to help navigate this really, really tricky period for women. And unfortunately, none of the tools that I've mentioned are going to cure this. There's no curing what is a stage and a phase in life. But when you find the right combination, and look, I understand it's difficult to find the right combination. It's difficult from we don't understand the research. It's difficult from access to care, both with regards to cost and time to look into this, because again, this takes time to figure out which cocktail and which combination is going to work best for you. Also, many medical and mental health providers are not well versed in understanding that perimenopausal symptoms can actually start before 50. And for many women, especially women with ADHD, they're starting in their 30s. Now again, That doesn't mean that reproduction is over. It's not a black or white thing. What it means, though, is that we need to start listening to women, and we also need to be more mental health and ADHD informed with regards to perimenopause. So if I have a woman, and I've had multiple women come to my practice for what they're calling midlife crises, my children are going to college, this is going on, work stuff, life stuff, home renovations, all of that. And when we started talking about, well, when did these symptoms actually start? When they were telling me? Childhood. Not with menopause, not over the last couple of years, starting in childhood. Now, the thing is, though, if you don't ask the questions, whether you're on the mental health or the medical side of this, you can't get the answers. So for a couple of these women in my practice, once we started them, and I sent them to a prescriber because I don't prescribe, once we started them on ADHD medication, a lot of these symptoms got better. They are still dealing with the perimenopausal sides of things, but wow, when you are medicating the areas that need extra supports, isn't that something that life suddenly changes? But unless you know the questions to ask, and you as whether a patient or even a healthcare provider are taking responsibility in advocacy, advocating for yourself as well as advocating for a patient population who might not be as well versed. And bigger picture, why does this matter? Whether or not you have ADHD, the symptoms and the changes that come during perimenopause and menopause are real. They affect more than half the population. And this is no way to live. And especially for women with ADHD, you're underdiagnosed, which means that you are undertreated, which means as you are entering this period of life that we know is going to be challenging, if you are not getting the proper care that you have for this pre-existing difference, it's going to make this transition in life that much more challenging, because we know that ADHD plus hormone changes leads to higher levels of mental health issues, especially with depression. It leads to greater and sooner cognitive decline, and it can even lead to more substantial medical health issues such as cardiovascular issues. So healthcare providers, if you are seeing this, I implore you to take an ADHD lens when you are taking care of women. Don't just ask about what's going on right now. Get a good clinical history. Ask when it started. When did these symptoms actually start? And if they say, I don't know, one of the best questions to ask is, what was your locker like in school? What was your backpack like? How did you do with getting assignments done? Because I can tell you, if a woman had ADHD when she was a teenager, that backpack was a mess, that folder was a mess, it looked like a dog might have chewed it, the locker was a mess, and assignments were getting done at the last minute when the dopamine hit. And if you are a patient, don't stop seeking care. There are so many providers out there like myself in the mental health field. There are so many wonderful medical providers who can even speak in greater depths about the hormone changes as well as additional supplements that can be taken to help. But unless you're getting in front of the right people, you're not going to get the help you need. And it absolutely sucks that I feel like as a healthcare provider myself, I'm putting the burden on the patient. Because it's like, hey, we're going through enough here right now, but I'm going to give you one more thing to do and tell you that, hey, there are going to be doctors out there who either don't believe you or dismiss your symptoms, either because they're not informed or, quite frankly, because you have a vagina. But the reality of it is that, unfortunately, where we are at with regards to women's health care, we're not taken as seriously. There are delays when it comes to us getting care. There are delays even with regards to us getting pain medication to alleviate pain during simple procedures. If we aren't that voice to keep this movement going forward, then we can't do things not just for ourselves, but for our daughters and other generations to come. If you have any questions, feel free to drop them below, and thanks for watching.